We have the news you've been waiting to hear. COVID-19 data is improving in Washington. For the second straight week, county and state health officials shared that good news. Hello, I'm Aaron Luna.
And I'm Nia Wong. They say masks are reducing the spread of COVID-19. And Spokane's top health officer says he's cautiously optimistic as the curve slowly flattens. Maher Kawash has been leading our COVID-19 coverage. Mayor, so tell us about today's new numbers.
Yeah, well, it all comes down to this curve right here. This is good news, what's going on. We're on the verge of passing yet another peak of cases locally and across all of Washington, really. As you can see, there were a few days with more than 100 days reported in July, and we also even got up to 150 on one day in early August, but now just 61 total new cases in the last 2 days. Still a long ways to go, but reason for hope.
It's not often you find optimism surrounding COVID-19. This time it comes from a drop in new cases over the last 14 days. Just 2 weeks ago, Spokane County had 223 cases per 100,000 residents. That number now sits around 168.
We do seem to be on that downward trend, which is encouraging.
Dr. Lutz says the county is still testing just as much as it was a few weeks ago, so this drop in cases is not from any testing delays. He does believe the improved data is a sign of more people wearing a mask in public.
It will make a difference, but people need to be consistent with it.
State health officials believe Spokane's cases may be flattening out, just not yet declining. But that rate of new cases trending down may be a sign of what's to come in the next couple weeks.
You know, if they're continuing on that same trajectory, you can kind of expect an equivalent decline over the next subsequent weeks.
And just as COVID-19 cases decrease in Spokane, more people older than 50 are dying from the virus. COVID-19 has killed 108 people in the county to this point, 106 of which were older than 50.
So no doubt that those cases in the 20 to 39-year age group has driven our recent uptick.
People under 40 make up about 55% of Spokane's COVID-19 cases, and it doesn't take much for those people to unknowingly spread the virus to older people since they're mostly asymptomatic.
Is also changing how it's reporting its testing. So before, if I tested negative back in May and then tested negative again in July, that would all count as one negative result to the Department of Health. Now they'll count each negative from every person, even if it's coming from me more than once. Now I'm told they will be going back to adjust past results as well to make sure everything's okay. Nia?